My name is Claudie Pascal, and I was born and raised in Miami, Florida, to my beloved parents who are from Haiti. I went to Oakwood University, a small Christian HBCU in Huntsville, Alabama, and from there I went to Loma University in California. I initially was pre-med doing a post-bac program. My husband and I met through doing nonprofit work and mission trips in college, so I went with him to a free clinic he was helping put together. From that point on, I was set on dentistry, and I have been loving it ever since. After graduating from dental school at Loma University, I had the privilege of joining the faculty as an assistant professor. I was able to teach some of the fourth-year students, one of the rotations that integrated a lot of the whole person care that I especially valued. I also was able to do some teaching with the first-year students in the lab, helping them work on their hand skills with tooth morphology and things of the sort. In addition to that, I also had the joy of working in a community clinic, private practice, nonprofit clinic, and I also was able to do some public health, where I was able to go into schools and do oral health screenings and cleanings for little children. I am currently offering temporary coverage services for private practices in my local community. This is something that fits perfectly for me right now, and ultimately I see myself being more active in academia, mentorship, and even being involved in public health dentistry in a non-clinical capacity. Volunteering has been a big part of my life ever since college. While in college, I was a part of a nonprofit organization, and I was able to help put on tutoring programs, feeding programs, help put together health fairs in the communities, and also travel abroad to do mission trips. At Loma University, I was able to do some of the same things, and I also was on different committees such as the curriculum committee. I was able to be the ADEA representative for my school. I was also part of the spiritual and wellness committee at our school, and I've also received a few awards. I participated in research presentations at the California Dental Association conference, and I've also received other awards for being on the Dean's List and other leadership humanitarian service awards. So one thing that my husband would share with me in dental school when I would start to feel overwhelmed is the fact that you can't climb a mountain if it's smooth. I believe that dental school is like that mountain you have to climb before you get to the rewarding experience of being able to serve and impact your patients, your communities, your students, or however you want to serve through dentistry. And considering the struggles and the challenges that come during that climb, some of the things that I think are very important for dental school is, one, having a clear understanding of why you want to pursue a career in dentistry. And the other thing that I think is important is being aware of what your strengths and weaknesses are. Being aware is going to allow you to know when you need to ask for help and to create the systems and identify the resources that are going to help you navigate the challenges that you may experience, and being able to prioritize your well-being and finding what things help you to stay well and help you perform your best are very important. And the other thing I would say is being ready to not just lead, but also serve. And I think serving is a big part of leading. In order to truly lead or grow or excel or do whatever that you're doing well, you have to first be willing to listen and to learn. I think that when we go in with that kind of a mindset, we are going to be able to succeed. I believe my greatest strength as a coach and consultant is being mindful of the big picture. When it comes to studying, when it comes to applying, it's important to not get so caught into the work you're doing that you don't realize the other factors that may be impacting the quality of your work. So my strength is being able to just really listen and be attentive to my student, applicant, client and identify what it is about them, what's their story, and then after understanding what their story is, why they want to do this, then we figure out how best do we put this on paper, how best do we equip ourselves or equip the applicant to be able to stand out as a quality candidate, and then create the systems, stay organized, stay accountable, and do it well. I am passionate about helping students because I know firsthand how it feels to be overwhelmed by a process or a goal that you never have been through before or even imagine yourself going through. I was the first in my family to become a doctor, and a lot of the things that I had to do, I had to figure out on my own. I would not have made it without instructors and friends who offered to give me their advice, offered to give me their help. And as a consultant, I am able to do the same for clients that I work with, providing them help and resources so that they don't have to go through this process alone. And I love just being able to help individuals simplify concepts or processes, make it more manageable and attainable, customize it to their needs, what works best for them, and help them achieve the success that is possible. I am passionate about making an impact, not just in the lives of my patients, but also in the lives of future healthcare providers who will then be able to continue to also make an impact in the lives of the patients and the communities that they serve as well.